In the name of Allah, the most merciful, the most beneficent. Today we are going to discuss wound healing. Wound is the third major reason of medical visit in developing countries after heart diseases and cancer. What is wound? Wound is a break in the integrity of skin or tissue, often which may be associated with disruption of structure and function of that particular tissue. Wound healing is a complex process which have four major overlapping reasons. First one is hemostasis, that means blood clot formation. Second phase is inflammation. Inflammation is the response of the body to painful stimuli. Third phase is cell proliferation and remodeling, cell proliferation and migration. And fourth phase is remodeling. So these four phases are overlapping and they are associated with each other to heal the process. So, for a proper healing process, these four phases are supposed to occur at particular time after one after regular interval. So, for wound healing process, there are a number of factors which actually influence the healing process. There are two groups of factors. One is local factors, and the second one is systematic factor. The local factors that leads to impaired wound healing are oxygenation, infectious agents. Systematic factors include nutrition, obesity, age, diabetes, smoking. So we will discuss these factors one by one. First of all, local factor. Oxygenation. Oxygenation plays a vital role for wound healing mechanism. ATP production and cell metabolism. It avoids the wound from microbial infection, is rises keratinocyte differentiation, reepithelialization, migration, and increase collagen synthesis, reduce the wound size and fibroblast proliferation. The absence of oxygen can cause impaired wound healing. The wound healing process triggered by hypoxia, but continuous absence disrupt the healing after injury. Hypoxia act as a signal in acute wound that stimulates numerous characterize, characteristics of healing mechanism. Hypoxia can pursue growth factors and cytokines produced from fibroblast, macrophage, and keratinocytes. The second local factor is infectious agent, Streptococcus pathogens, Streptococcus aureus, E. coli, Pseudomonas, and there are other number of common microorganisms that cause wound infections. Wound infection is one of the important reason for improper or impaired wound healing. When skin is injured by cut or surgery, microbes that are usually present on the surface of skin gain contact to the underlying tissues or cells. The condition of replications and infection of microbes depends upon wound classification as having colonization, spreading, invasion, infection, contamination, and local infection. In wound healing process, inflammation have a vital role for the elimination of contaminating microbes. The process of inflammation may be long in non-appearance of active decontamination. The existence of bacteria at the site of wound occurs in the form of biofilm comparable to other infections infective mechanism. The biofilm of bacteria present at the infected wound site, which are most complicated group of bacteria fixed in extracellular matrix and polysaccharides. Then we will go for systemic factors. Systemic factors are factors that disturb the overall wound healing mechanism due to healing of disease situation. These factors are nutrition, obesity, age, diabetes, and smoking. First of all, nutrition. For thousands of years, nutrition play a vital role in healing of wound process. Precise nutrient precise nutrient shortage and malnutrition can influence the healing of wound after surgery and trauma. Patients often require a special nutrient in chronic wound healing due to nutrition deficiency. All nutrients such as carbohydrates, proteins, fats, minerals, and vitamins have great effects on wound healing process. Collagen is composed of hydroxyproline, glycine, and proline contain protein components of connective tissues. Any deficiency in these components leads to the impaired wound healing. Fatty acids and lipid provides energy for proliferation, dermal and epidermal tissue throughout the healing process. Proteins are responsible for stronger immune system and help to and tissue growth, repair and tissue growth. In addition, efficiency of chronic zinc leads to inflammation. Then second systemic factor is obesity. Obesity is global public health problem with an increasing alarming situation over the last 2 decades. An enlarged infect incidence of wound problem has been stated for overweight patients suffering from both bariatric and surgical obesity. The increased rate of wound healing infection happens in overweight individuals. These complication of wound arises in adipose tissues of skin that occurs due to ischemia and hyperfusion. The situation of wound complication may occur by infection, inefficient delivery of antibiotics in surgical wound. Obese patients suffer from wound healing infection due to creation of tension of wound sites. Wound tension reduces the microperfusion, availability of oxygen, and increased tissue pressure. Connective tissue regain the exposure to eth- of ethanol, which decrease the production of collagen and protease stability changed at the site of infection. Third systemic factor is age. Aged people suffer, such as over 60 years, have quicker growth rate than most aged group of people. The major factor that involves the improper healing of wound is elderly aged people. Many animals and clinical studies at molecular and cellular level have observed age-linked variation and interruption in mechanism of wound healing. Previous studies showed that the influence of wound healing causes due to age of elder people but don't have any effect in relation of quality of wound healing process. In, in a study, growth of fibroblast, wound contraction, and collagen production decreases due to the elder age patients. Numerous treatments have been examined at age-related improper healing. Remarkably, a treatment has been testified to recover wound healing process in aged mice and in other older patients. The fourth factor is diabetes. Diabetes affect millions of people in the world. Diabetic people show an improper healing of the chronic wounds. There is a balance between promotion of vessel proliferation, growth, and maturation in wound healing mechanism. Diabetic disease situation can expressively disturb this balance, disrupting the tissue regeneration, appropriate wound healing, and to restore the healthy vascular system. Diabetic hyper diabetic hyperglycemia such as uh, diabetic hyperglycemia has been concerned in development of vascular disorder in both clinical and animal studies. A recent study demonstrated that the higher level of glucose in diabetic people cause several micro and macrovascular diseases that can lead to impairment of wound healing process. The process of neuropathy happens in diabetic people also leads to improper wound healing. These neuropeptides such as calcitonin and nerve growth factors are contributing in wound healing mechanism because they encourage growth factors creation, uh, arose proliferation and cell and promote cell chemotoxins. The fifth factor, systemic factor, is smoking. It is renowned that smoking raises the danger of vascular ailments, lung diseases, heart, stroke, and cancer. The smoking may have many negative impact on the wound healing mechanism. It has also been reported that the patient who smoke have slower healing process as compared to the patient with normal with those who do not smoke. That's all from my side. If you have any question, please contact. You can always ask me.